Okay, so can everyone see my screen okay?
Yep.
Okay, so this is, once you log into the portal, this is the screen that you'll see. This is...
No, it's still going to the Greater Columbia.
Okay, you're right. Yeah, you're right. Okay, let's start from the beginning. Okay, so when you log in, this is the screen you'll see. Under My Communities, you should see Greater Columbia Practice Transformation, and you can go ahead and click on that. But I also want to show you that you can also click on upcoming events to go directly to the calendar, and you can click on this document hyperlink to go directly to documents. You can also click on this member link to take a look at our members in the community, and I can show you how to do that on the homepage as well.
And then if you see up on the top where it says available communities, those are other communities that are not private that you can sign up for, and then you can look at to see, you know, any things that they have on their portal.
So we'll go ahead and go into our community page. So now this is the screen you'll see. This is the home page, or what we call the community page. I'm signed in as myself right now, and I'm an admin, so you'll be seeing other folders on here as well that you may not have access to, but we'll make sure to show you guys your individual folder. So first I'll start with this bar on the left-hand side. First is the calendar. So if you click on the calendar, it'll take you to our community page calendar, and this is where I'll put meetings such as learning collaboratives, leadership council meetings, and then I also have our the reporting due dates in here, which are in red, and all of the reporting due dates will be in red, and monthly meetings will be in blue. So if you click on one of these, you can click on read more. And there's not a whole lot of information in here yet, but I will be updating this as we go. But some important things to note here is that you can download each event directly to your calendar, which is really useful. You can also click on this notify me about this event, and this will notify you every time I update the event, if anything changes, which is really useful. But it should also update on your calendar. So if you don't want to get notified and get tons of emails about a particular event, you can just download it to your calendar, and it should upload that or update that as we go. And Martine, feel free to stop and comment on anything. And then back to the home page. Oh, goodness. So this document folder is really important and really useful. So if you click on this documents folder, you'll notice all of these folders on the left-hand side. So you won't really be using the IMC organizations folder, but you would be using the meeting documents folder. And this folder is something that everyone in the community has access to. So what I'll upload here is similar to that of the GCACH website, but I'll upload all of the meeting documents for the learning collaboratives and leadership council meetings. In these folders will be meeting materials, the recording, and the minutes, I believe. So this one doesn't have a recording, but this one should. So if you ever need to reference these, if you missed a meeting, you can take a look at these. You can even download them directly to your computer if you'd like. I believe there's a way to do that.
On more.
What's that?
On more.
Can you do this?
Oh yeah, zip it down.
Yeah, so okay, so if you want to download an individual document, you can just click on more and then download and check out. But if you want to download the entire folder, you can go to folder actions and click zip and download, and it'll download the entire folder to your computer, which is really useful. And then in the PCMH organizations, you will see all the Astria folders. We've granted you permission to those. And so within those will be the same documents that were in your Dropbox. So they should have all the exact same titles, all the exact same file structure so that you know where everything is. And Martine, do you want to talk further about this?
Yeah, so on here, this is really similar to Dropbox, like Lauren mentioned. So the assessments, the MEHAP, and the PCMHs that we've done are going to be under the contract, payments, the PTAW, which is the change plan, supporting documentation. That's really important. This is where any documents, say you have narratives or the reports that you guys are pulling for reporting purposes, that we want you guys to upload them to the supporting documentation. And if you go to folder actions, click on it, and then you can add a new files on there. Click on that, and then this will pop up, and it's really easy to upload the files. So you hit on upload files. You can either drag them on this box, or you can click on the box, and then or go to upload files. Click inside, yep. And then you can just drag them on there, or you can select them, and then open, and then add files, and then you just will hit save. And once you click save, they will show on the supporting documentation folder. And if by any, there's any, I don't know, it doesn't upload by any chance, please let us know right away, or anything happens on the site that, is not normal, because everything should be working correctly. We've gone through this page multiple times. Myself, Lauren, Jenna, other people here in the office. So if anything happens, let us know. That way we can contact CSI and let them know what's going on so they can fix it.
Something that's really useful too is that if I know that all of you have probably been the recipients of my constantly changing meetings. So something that's nice with this portal is that you can upload a new version of a file without giving people all these notifications. So if you see this 2019-01-17 meeting packet, if you click on this more button, you can press new version, and it gives you the opportunity to upload a new version without notifying whoever has subscribed to this certain folder. So you don't have to upload multiple versions and say version 1, version 2, version 3. Instead, you can just click new version and upload that. And then PCMH resources, we're constantly adding new documents to these folders. And these are documents that Jenna and Martine and Sam have found useful and thought would be useful for you guys to use and reference. So I highly suggest going through these folders and taking a look at the resources we've uploaded. And if you have any others that you think may be useful for other sites and other providers, please forward those to us, and I'd be happy to upload those as well. And then this user resources folder is mainly, I believe it just has our recorded training from last week, but something we want to start doing is if we receive a lot of questions about the same thing, we want to create a FAQ document, and that way you guys can reference that if you're having troubles with the portal.
And that recorded training that you guys see on the screen, that's the one we hosted on the 26th. And this one will probably go into a little bit more detail from what we're telling you guys. If you guys want to, go back and kind of check it out, please feel free. There was a person from CSI going through this page and kind of explaining everything in very good detail.
Mm-hmm. Another button you'll notice is this heart button on each folder. You can click on this heart button if you'd like, and it will subscribe you to this folder. So anytime anyone makes changes to this particular folder, uploads a new document, uploads a new version, you will get a notification. So that could be useful for maybe a certain resources tab, or even for the meeting documents if you found that you like to attend all the Leadership Council meetings and for some reason you missed one, you can subscribe to that folder and you'll get a notification once I upload those meeting documents. And to unsubscribe, you simply just click that button. So this is subscribing when you click on it. And then to unsubscribe, you just hover over and unsubscribe. Okay. Okay, next is the Forums tab. And I thought Jenna just posted one.
Yeah, sure.
Is it under milestones? Cool. Okay, so this Forums tab can be very useful if people utilize it. The purpose of this tab is if there's certain questions that providers or sites want to ask the community, they can do that by simply typing in a question and then waiting for other people to respond to it. So let's take a look at this first one. So Jenna posted this question. Looks like talking about shared decision making. And then from there, people can respond. So it looks like Kendra Palomares from Catholic Charities responded. And this is something that every member of the community can see and every member of the community can post on. So this can be a resource for the entire community. I believe that when you register, you are subscribed to the forum.
Yeah.
So everyone should be getting some sort of notification that someone has posted in the forum, and that can be changed as well. But I think this would be really useful.
Mm-hmm. Or if you guys have any questions, you know, kind of similar to this, you guys don't necessarily have to send them to us. Mm-hmm. You guys can just go in and start a new thread, and then, you know, that will kind of alert everybody like, hey, something, you know, has been posted. And then they can go in and read what you posted and then give you feedback or, you know, give you ideas or answer your question.
And to change your subscriptions for the forums, you can just go into My Settings and unsubscribe if you'd like. Another communication tool that the healthcare communities has is the listservs. And this is a little bit different from the forums in the fact that each community member has the ability to type in a listserv and send the email to each community member. So this actually sends an email outside of healthcare communities to each member in the community, in the GCACH community. So it's similar to the forums in the fact that it's a communication tool, but instead of posting internally in healthcare communities, it's external via email. So right now, this is not, we don't have any sort of lockdown, any certain settings to minimize the amount of traffic on this, just because we wanted to see how it's used, if it's used. If we find that people are abusing it, we'll definitely change those settings. But as of now, we're just hoping that this gives everyone an opportunity to learn from each other. And I don't think anyone's used this quite yet, but I believe Jenna just posted in the forums this morning. So another tab is the Members tab, and this shows you all of the members of the GCACH healthcare community, and it shows you their name, their organization, and their location, but I believe you can also get their email. Yes, you can get their contact information from here as well, which would be useful. You can see that we have everyone that's registered in the GCACH healthcare community is on here. And then next is the video library. So if you click on video library, This shows you all of the videos or recordings that we have uploaded to healthcare communities. So what's nice about this is you don't have to download any flash players. You can watch all of it right here on healthcare communities, and you can download them as well, just like any of the documents. So we have them organized. So I have the CSI portal training, its own folder. Greater Columbia, if you just click on here, it gives you all of the videos. Leadership council meetings, those are just the recordings from the meetings, and learning collaboratives, those are also the recordings from the meetings. If you by chance missed a meeting, or if you just want to go back and reference it, you can watch these. If you have 2 hours, you can go back and watch those. And then really quickly, I'm just going to take you over the layout of the page, and then Martine will show you the reporting portal. So this right here, this is just a description of the community. And then you see these icons: calendar, forums, help, documents, and listservs. Those are all also listed over here on the left-hand side, but if you, for some reason, like the icons better, you can click on them there. And then you'll see these announcements. We're going to start posting reminders of when reporting's due. And then we have this welcome letter in there. It gives everyone the emails for the team. If you're having any troubles with the portal, you can email us, reach us that way. And then these upcoming events, I believe it's the 5 events in the next 2 months, I believe. And so this is just a short list of the events coming up, and you can click on them if you'd like and find them that way, or you can click on this go to community calendar and go to the entire calendar. Photo gallery, these are just some photos I uploaded. I think it's fun if some of our sites have any photos of maybe inside the room they work in or of their team, and I'd be happy to upload those here. I believe you can also upload them yourselves if you'd like. Can't you, Martine? Everyone has access to?
I'm not sure on that.
I'm not sure, but I think you can. If you can't, please forward me any pictures, and I'd be happy to upload those there. But these are just mainly from our Practice Transformation Kickoff meeting. Outside links, these are fairly the same as the links in the training, but this is just another way to find them. If you want to find something quickly, you can just click on them, and it takes you directly to that link. And then recent tools and resources, these are all of the recent tools that we have or resources that we've uploaded. So here, obviously, you wouldn't see Dayton General Hospital MEHAP survey, you wouldn't see this budget, you would just see resources that we've maybe uploaded to your individual folders or the generic folders that everyone has access to. You wouldn't see these other folders or these other documents. Those would be hidden.
And then there's also a search feature on here that you can search, any keywords, like shared decision making. You hit search, and then you can even filter it down by type. If you want a Word document, PDF, or any other types, and then you can just click on that document type, so PDFs, and then you hit search down at the bottom, and then it should filter your search only to shared decision making with that are PDFs. So, and then again, you guys will only have access to those documents that haven't been locked down and are in the general folders.
And something that's nice about this search feature is that it searches the entire document. So it won't just search the name for the name shared decision making. It'll also search within the document. So if shared decision making is referenced within the document, it'll pick up on that, which is very useful. Another thing that's useful is this on or after date. So if there's a certain date, that this document was posted, or a certain meeting, and it's during a certain time period, you can search that here. Okay, is there any questions so far on the community page, or are we ready to move to reporting?
I'm good.
Okay.
Yeah. So to go on onto the reporting from this webpage, then you guys will only have to click Greater Columbia Measures. Once you click on that, it will take you to this page. You guys will only see the Astria organization folders. Right now, we see all of them because we're admin, and then it'll tell you the quarter, 1 or 2, so it'll be quarter 2 for reporting, and then gives you the drop-down menu of the milestones, and all 8 milestones are on here. And then we'll go to one of a folder that belongs to Astria when I find one.
So while you're looking, Martine, with regard to the milestones, as we know, there are various timelines and deadlines for different aspects of certain milestones during different quarters. So when you select, like Sunnyside, for example, and then you select Q2 2019, when you go to each of the different milestones, will it only have the items that are due, or is it going to have everything? And
it's going to have everything, so all of the milestones. So for quarter 2, so we'll click on quarter 2, and then we'll select milestone 1, and then this should pop up. And then all of the data that was entered on quarter 1, so the workbooks that you guys turn in for quarter 1, I've inputted into quarter 1 reporting of the portal, and everything carries over to quarter 2. And yeah, so for example, milestone 7 is not a reported item until quarter 4, but you guys still have access to that milestone.
Okay, so it won't have, like, depending on the quarter you're selecting, only the items like that are due. So like I remember, I think that, you know, there's the behavioral health component. There's a lot of that that's due for this particular month or this particular quarter. But even in quarter 1, those boxes would still be. Okay, I'm just asking because that, I mean, if it were, well, it doesn't matter. Okay,
right. And yeah, and through this, you know, this whole process, I'll be reminding you guys too when we meet, you know, what milestones are due and anything else that we need. So this is, you know, your basic quarter 1, which is your budget. It was already turned in. There's a feature on here on the other milestones as well that lets you upload a file. So you can just hit choose a file, this will pop up, you select it, and you can click open, and it should be uploaded to this portal on here, which we have access to view. Once you do something on, you know, you change a number or something on here, this on the left hand or the right hand side that says save data will turn blue. That means you've made some changes. Once you hit save, it will automatically save it, and it will turn white with green. So that means that's saved. And this button right here scrolls you all the way up instead of, you know, milestone 2 is fairly large. So clicking that button saves you kind of, you know, from scrolling. So we'll go to milestone 2. And then sometimes it takes a little bit to load the milestones depending on how big they are. So here we're on milestone 2, and then this is empanelment. Again, the data from quarter 1 carried over. So for quarter 2, it would be a matter of going and updating any of the numbers or information that I have changed from quarter 1. And then if you guys see here, this is the risk stratification methodology and types. These boxes are multiple selection, so they let you select multiple options. And then you guys see here, this turned blue because I'm just clicking on here. But these are already selected for you guys from quarter 1. If you guys, you know, were to select, you know, publicly available algorithm, please list known criteria. We have added text boxes where you guys can, you know, type in your response for that.
You do have to make sure to save the text though that you click that box.
Yeah.
First.
So it's not just typing it in. You have to hit this box and then type it in, because if you only type it in but don't hit the box once you hit save, that will erase. it will not keep your data. So it's really important to click this little box. Same here. And all the options that you guys have on here will have an other box with the text box on here. In case it's not listed up here, you guys can type it in at the bottom. And then here, this is kind of regarding how patients are being stratified and being recorded in the EHR. So this is the narrative that was provided from Q1. And again, this is the feature that lets you upload a file. Say you have it in a Word document and don't want to do copy and paste, then you guys can just upload that file on here. And then these are the risk stratification numbers. You guys type them in here, and then it will automatically do totals and then percentages right here on the right-hand side. Once you hit save, you enter numbers and hit save, those numbers will appear on here. And then again, this is multiple selection. Same for this, and then there's the other. And then same here, just entering your numbers, and then average patient caseload per practitioner this quarter. And you guys would just type in your numbers on here. And then again, the narrative box. So this is the bidirectional integration that you were talking about, Stephanie. So this is a Q2 report. So you guys will be reporting on this, which for this workbook, which is, I believe, the health center for Sunnyside, they've, for Q1, they filled out this section. So I went ahead and uploaded it to the portal as well. So it'll just be a matter of going in and updating any of the information that might have changed. On here, you guys, the only difference from your workbooks that you guys were working on for Q1, we have added this specified other form of integration. This is for behavioral health organizations that we are contracting with that have to do practice transformation. So we've added this box to so they can report on this portal as well. But then again, these are multiple selections as well, because some organizations are doing a combination of these three integration models. So there's, you guys can do, like more than one on here. For this, again, multiple selection, and then there's the other, and then on here, this is how have you organized the behavioral health services in your practice, and for each of the services, identify who provides the services and how they fit into the system of care. So here we have screening, and then this marks, who provides those screenings. Is it the provider, the, registered nurse, the MA, is there a behaviorist, practice care team, and then if you guys don't see any of the options that you guys have listed on here, you guys can click other, and then a text box will appear where you can type it in. And then that's for all of the options that are listed on here. And then again, there's the other on here. Those options are listed up above. And then this are just assessments that we've done. We've done the MEHAS and then the PCMH. And then you guys mark the AIM-centered, patient-centered, integrated behavioral health care principles and tasks. So I went ahead and marked it on there. So on here, for Q2, well, you guys will need to specify what tools are being used. So that's why we provided a text box. For anything that has changed, please provide the updated information. And then this box is just asking for a narrative, how many patients are receiving integrated behavioral health services and are being tracked in the EHR standalone registry. So we'll need a narrative for that piece. And then number 7, this one kind of has more drop-down menus. And it's asking for evidence-based instruments or screening tools that are being used to assess patients and or monitor or adjust care, and then select all that apply. So if you guys select, let's do this one, the brief psychiatric rating scale, you hit the first drop-down menu, yes or no. So let's say yes, and then when and how is the tool applied. So you guys would just click, it said, identify need for care, follow-up and monitoring, engage patients in decisions about care, planned care, or other. The box will appear, and then you guys just go on to the next one, and then the team members that are using this tool. So we hit the drop-down menu, and it's the physician, the nurse, the MA, health educator, or any other. The box will appear. So you guys will have to, type in the response on there. And then I will go ahead and then mark all of these so you guys don't get confused. Oh, and I did no. I won't see. Sorry, I clicked on something else. So we'll go back, and then since I didn't hit save, nothing like this will appear on here that I didn't unclick. So that's why it's important to save. And then all of these have the yes or no, and then when and how the tool applied, and then the team member using that tool. So we'll scroll down, and it's a big list. So for you guys have selected EMR questions regarding history of drug abuse, and then so we'll hit yes, and then you guys will just have to explain how the tool is being used and who uses that tool. And we'll scroll down again. This evidence-based instruments, treatments that your practice make available to patients, in addition to medications, so behavioral activation, and other referrals, psychiatrists. And then this box that you guys see here, the top small box, we will have that deleted, and it will be only the big narrative box. Some of the organizations have added big narrative, so this little box wasn't big enough, so we had to keep scrolling to the right instead of seeing the whole thing. So that's why we added that big text box. And on here, when does the practice do systematic case review and consultation? And this will only let you click one option, so it will change. So it's not, it won't let you do multiple selections. So here, we can do review team, same thing, kind of going down, narrative box, multiple selection, and then self-management. And on here, if you guys see the little green eye, if you hover over that, it will give you more information as to, more detail into that option. So, and then that's option A, and then here's option B. And then you guys have selected option D. And then we keep scrolling down. And then conditions, so this should have been selected, so I don't know why it's not saving it, but I'll look into that, why it's not saving the options. But I did have, I believe it was depression, diabetes, and COPD, I believe that you guys had selected on here. But then
what section is this?
This is 2B2, self-management.
2B2?
Yeah, number 2. So you guys would, do your depression, and then trigger self-management, all patients with the condition, general risk status using the practice risk stratification methodology, poorly controlled disease, data from a formal self-management assessment tool, patient expression of interest, or any other. So you would just click what applies, for what triggers self-management for depression. This one didn't save it either. Huh.
2B3.
Yeah. The same one. 2B2, number 3. Okay. So again, you would go on here using the same conditions from up above. You would just select it, and then it saved, who provides the services, their training credentials, and then the number of patients that received that intervention this past quarter. So this was quarter 1. Hopefully by quarter 2, we'll have different numbers. And then what cross-condition strategy? Again, selection, and it's not saving it. Huh. Okay. Again, who's doing the work? And here, what evidence-based counseling approaches are you using self-management support, motivational interviewing. So if you select it and want to provide a narrative, go ahead and do it as to how you guys are implementing motivational interviewing, how it's being used. And then again, the drop-down menu of who's doing the motivational interviewing. Is it the RN, the provider, the MA, health educator, behaviorist, whoever is providing the motivational interviewing. And then again, this text box will be gone, and we'll just leave this big text box on here. And what specific self-management tools are you using? So you would type it in, what self-management tools you guys are currently using, and then the team member using those tools. And it's the same list for all the drop-down menus for the providers. So if nothing's on there, again, there's the other with that text box that will appear for you to type in your answer. And community-based health organization, and it's not saving with you. So that you guys make available to your patients, and how you guys make the link between the patient and the resource. So is it a referral? You guys just provide information to the patient, or is it a referral that you guys are expecting feedback and tracking that referral, or any other? And then how have you added training? You just select, or capacity to support self-management in the past quarter. Do a selection, it's multiple selection, and then what measures, and then didn't take the measures either. Or selecting the measures for self-management on care processes and health outcomes that you have identified. So, and these are the same from milestone 5. So I'm not sure why they're not saving. So they were all selected, but you guys see here, what measures you guys are tracking for those conditions. So it's like pulmonary function testing, depression screening and follow-up, and then A1C testing.
I do want to note really quick. So this is a new portal, as you guys know, and so we're still working out the kinks. So if for some reason you're going through and filling out the reporting workbook, just please let us know if there's, for some reason, something's not saving, or if for some reason there's not a text box and you think there should be a text box because you want to include more text. Please let us know, and that is something we can talk to CSI about adding. We're happy to do that. So I think this first round will just kind of be everyone testing it out and seeing if there's text box where there needs to be text boxes and things like that. So any feedback you guys have is really helpful for us.
So I have a question. So with this then, if it's something that was answered in the previous, quarter workbook, then it appears as though the answer is still populated there. And then if we need to make a modification to that, we do that. Otherwise, we just leave it the way it was initially answered.
Right.
Okay. So then there won't be like hard stops then if it's something that wasn't due in quarter 4, I guess it was now, right? Or quarter 1. Yeah. If it wasn't due in quarter 1, there won't be like a hard stop for something that's new. We just have to like use that old paper thing to help us kind of remember what is due this time versus next time. Okay.
Yeah. Mm-hmm.
Martine, do you have any sort of tool we can use that'll just clearly say, like, I know this sounds kind of silly, and I'm sure I can put something together for our team here, but off the lines of Stephanie's question, is there just a tool that you have that says, like, these things need to be updated for quarter 2?
Yes. Yes, and I can
for me, that would be most helpful. Like, I mean, I'll go through, obviously, and do all of this. It seems like a pretty straightforward tool, and probably a lot easier than the actual, like Microsoft Word thing in that Dropbox. But it would be benefit, like if you guys are taking feedback for future quarters as this tool continues to be enhanced, to have something that just kind of, if it's not something that needs to be revised in this particular quarter, or if it's not due until, quarter 4 of 2019, then, it not pop up every time, because then it seems like we're not answering something that maybe we were supposed to, if that makes sense.
Right. Yes. And I believe there is a feature that CSI has that lets you turn off a specific milestone.
I think so.
Yeah, so we can look into that, Stephanie.
I just think that for those of us that are doing it each quarter, I mean, that would maximize our time in making sure that we're answering everything that we are expected to answer, but at the same time not going through and unnecessarily adjusting something that may or may not, like the budget. I'm not going to touch the budget, but it's there and I could touch it. So that's
right.
You know what I mean? So just a thought. I do a lot of reporting, so
yeah, no, that makes sense. Yeah.
I do want to note too, since you mentioned Dropbox, and I know this question was asked during the training last week, but the purpose of this portal is to eliminate Dropbox.
Yes.
So instead of using Dropbox, we'll be using this portal.
I think this is going to be a much, it appears from just observing the questions being answered, it appears as though it'll be much more efficient than Dropbox, than the tool that was in the Dropbox that, we saved in. So I agree.
And in that workbook that you guys filled out, if you guys have a copy of it laying somewhere or in your desktop saved somewhere, I believe it's the third page, it has the reporting schedule, so it'll tell you what quarters, what milestones are due when. So that's one document, but I can resend just that one page so you guys can have for reference as well.
So I did not save a version of the first workbook in my files on my computer.
The good thing is that on your folder for Astria, I have saved a copy of that first quarter workbook. So you guys can always go into your folder on this platform and look under, I believe it's under Toolkit and Reporting Workbooks. And it would be quarter. Yep. So it is under.
Perfect.
And on here, if you guys mark, comprehensive medication management services, if you guys, for this, provide use of other guidelines for prescribing opioids, there's a narrative box that will let you type in, what guidelines you guys are using if it's not listed on here. And then again, same here, key clinical decision support features for opioid prescribing guidelines, specify any way to type it in and select it, and then linkage to behavioral health care and map for people with opioid use disorder, and then specify the pathway, and you would just type it on here, and then of course, select this little box. And then please provide a narrative for your response to 2A above. You enter the narrative, and then again, multiple selection on here. How many hours per week the department is engaged for coordination of care medication management, 2 to 3 hours. And it's laid out almost the same. If there's a question that, asks you to specify or indicate, if you guys will have this narrative box on here. And then, so it's a lot easier to navigate and use than, the workbook on Word documents. A lot less confusing, I believe.
So, Martine, sorry to interrupt. Just a question on the milestones again, kind of the different types of things that we need to update. We don't actually need to update anything that was selection, correct? We only update things in Q2 that need data with it, right? Because the selections will stay the same unless we elected to change something from diagnosis of COPD. But if we plan on keeping the diabetes, COPD, and depression, we don't modify that. We just move on with it.
Correct.
Okay. Sorry, I know this is probably hitting the dead horse multiple times, but I just want to make sure I'm understanding correctly what we need to edit, since you did pre-populate a lot of this stuff.
Right. Yeah. So anything, that doesn't need to be changed, then just leave it, and then just updating kind of the numbers on the data or narratives.
Awesome. Thank you.
Mm-hmm. So then, Martine, with that being said, I guess I don't really know this clinic version one, but where there is, let's say, we'll just use this empanelment status question here. So the total number of patients impaneled. So for Q2, we're changing this to, let's say it's 600. So you just go through and make that edit, but then in the other workbook in Q1, that's just going to have those old values there. And so it's...
Yes, so it won't change anything prior to...
That's been previously saved. It's just going to let us modify what's been pre-populated. Okay.
Yes, yes, and then same for Q3. Once you guys are in there, these numbers for Q2 will not change, or the ones from Q1.
So let's say, can you scroll down in the risk stratification methodology? Let's pretend that I'm Carlos and I, for whatever reason, decided to review the patients with a diagnosis of CHF, for example, as opposed to a diagnosis of depression. I'm making that up, but would we need to then, since that's going to be a different, since we already reported in Q1 that those were going to be our areas of focus, would we need to then make a narrative or a comment about why we elected to make that modification to our initial plan?
Yes.
And where would we do that?
And then that document, that narrative, you would upload it to on your folder. There's a folder called supporting documentation, so that's where you would upload it, that narrative.
So, and that's only for specifically, like, if we're going to change something, like in this answer.
Right.
And then the rest of it, if there's narratives, you just type into that field. But if we're changing something that we've previously identified as a plan or one of our goals, then we just upload the supporting documentation. Okay.
Right. Yep. So this has turned blue because I've been clicking on here, but I will not save anything. I will just go on to Q3, and then Q3 is the rest of the quarters, or milestone 3, sorry, are fairly short, like you guys, have seen. So 24/7 access, yes, and then there's that little, icon again for information. It gives you more information as to what, 24/7 access looks like. And then again, how the practice provide enhanced patient access, multiple selection. There's the other. Time spent outside of the office visit that staff spend. So here's the physician, MA, and then the estimated hours per week that they're doing that. So for Q2, it'll just be updating this information. Then there's any other, if you guys have added any other ones, you guys can add them on here. And then this is just asking how you guys are providing that information to your patients, letting them know that you guys have enhanced access. It says poster in the office, website, mailing from staff. You select it. Milestone 3, fairly short. Milestone 4.
I think we kind of get the gist of it. We don't necessarily need to go through each milestone unless there's like specific things in each milestone that you want to highlight.
Yeah, so on here, I will, again, click this when you write in your narrative. It should be already on here. So this is Q2, so it's already on here. But if you guys, by any chance, unclick it and hit save, it will not save it. So please make sure that that's checked. And again, pretty similar. And then again, we'll see why these are not showing up for the conditions. But that's milestone 4. And then on milestone 5, that's the clinical quality metrics that you guys are supposed to be tracking. And for those, you guys have comprehensive diabetes, eye exam retinal performed, hemoglobin A1C testing, and depression screening and follow-up for adolescents and adults. Any reports that you guys are pulling for reporting purposes, we would, on these items, we would like you guys to, again, submit them or uploading on that supporting documentation folder. And that will show us, your the work that you guys have been doing on these CQMs over the past quarter. And then we'll scroll down, and then there's the other. So it's fairly similar. And then milestone 6. Once we're there, again, attestations, yes or no, and then multiple selection. And then on here, you guys would pull in your numbers for quarter 2.
And it pre-populates the percentages, right?
Yes.
Okay.
So if you guys see the green rows, once you put in your denominator and numerator, it will do the math for you once you hit save, and it will give you your percentage of patients that you guys have contacted. And again, option B, putting in your numbers on here, and it will populate your percentages. And then milestone 7, you guys don't have to worry about it, and then we'll see if we can turn off that milestone. So it will create less confusion. And then milestone 8, again, attestations, yes or no, multiple selection to what other organizations or entities your EHR is able to exchange electronic health information, and then yes or no that you guys have met with your practice transformation navigator. And then once you're on here and have updated milestone 8, you just hit save. It will save it, and then from here you can go back to the main page and kind of look at other things. I'll show you the supporting documentations folder. So you will go to PKMH organization, and only Sunnyside will go to the Sunnyside Hospital. It should have the supporting documentation. On here, you click on it, and then here's the toolkit and reporting workbooks. And then this has for Sunnyside, it has the hospital and the medical center toolkits and workbooks. So here's Q1, Astria Sunnyside Hospital reporting workbook, Q1, Astria Sunnyside Health Center practice transformation workbook, and you can click on it. It will show, here's the toolkit, the revenue share models for each site. So once, for those narratives, if you guys change anything, the reports for CQMs, any reports that you guys want to share to show your work, you can just go to this folder and just add a new file, and then it will just, go through that process of uploading the file.
Okay, wonderful. So the way to submit then is just by hitting that save button?
What's that?
So like if I go in, let's say, rather than doing it, the quarter reporting is due on the 15th. So let's say, I devote 5 hours a day to this until it's done. So if I go in and just save it every time, that's not officially uploading it at the time when I'm actually finished with the report, finished with the workbook. Right. Is there like a load for submission or like submit workbook, or just by saving will that be sufficient?
Just by saving, and so the deadline is the 15th. So after the 15th, that's when we'll start looking into the workbooks.
Okay.
So really we could keep going in there all the way to the 15th or whatever?
Yeah.
Okay.
Mm-hmm.
And is that midnight on the 15th, or is that like 23:59 on the 15th?
12, that's 12, right?
11:59 on the 14th, or the 15th, the 15th.
So we have we can save our data in our workbook on the 15th. It's just that the 16th would be late.
Yeah.
Right.
Okay.
Martine, do you want us to email you at all, like when we are done? So if we do complete it, I don't know, by chance before, then we can let you know.
Yeah, so if you guys finish it before, just let me know, and then we can go in, or Sam can go in and look at your workbook.
Okay, and I have a follow-up question from something I've probably been asking a lot, but has there been any more conversation about creating a more hospital-specific reporting structure?
No, not yet. And for the hospital, the empanelment piece will be blank. For you guys, so you guys don't have to worry about that for the hospital side.
So just 2A.1.
Yeah.
Okay. Yeah, because I mean there truly are some significant differences between a hospital setting and a clinic setting in the way in which you prevent people from going into the hospital. So,
yeah.
And okay, perfect.
I do want to note too, I just want to explain the registration process to you really quick. So once you get that email from the portal prompting you to register, you can go in and register, and then that will then notify me via email that you've registered, and that's when I go in and give you permissions to the folders. So if you register, so you go and register right now. And
I'm doing it right now.
If you go to find your folder or go to find your reporting toolkit, you won't find it until I give you that permission. I try and do it right away, but if I'm for some reason in a meeting or away from my desk, I can't do it right away, but normally it'll be by the end of the day at least. So if you register today, you should have access by the end of the day for sure. So I don't want there to be any confusion. You go in to look for Greater Columbia Measures tab and you can't find it. That's because I haven't given you permission yet. But I try and do it as soon as I can. Are there any other questions?
No, I think this is going to be great. Thank you.
You're welcome. Feel free to reach out to Martine or myself if you have any additional questions, but we're happy to help.
Well, thank you very much again for taking the extra time to go through this with us. Sorry we couldn't make your the larger meeting that was scheduled last week.
Not a problem.
All righty,
okay, well, have a good rest of your day, and I will upload this. I'll convert this recording and upload it to your folder for you guys to reference if you need to.
Awesome. Thank you very much, Lauren.
You're welcome. Have a good day.
Thank you. You too.
Thanks, Martine.
You guys. Yep.
Thank you.
Bye.
Bye-bye.
Bye.